And then we have this temporary loop, which is kind of underneath it. The left is for analytical and logic. The right is for creativity and artistic. And then it also had this number 4 is the Broca's area for speech area. And it also had the Wernicke area, also the speech area. Number 11. This is another part of the speech area. And the motor cortex, number 3 is the motor cortex. Number 9 is the sensory cortex. The motor and sensory cortex are GV 19, 20, 21. On the temporal lobe, there's this Tom's Island insula. On the left is for focus. For the motor and sensory cortex, there's this homunculus picture, the little man, and it shows you where the pain could be for different part of your limbs, like here is for your leg and here is for your arm. Close to the middle, which is the GV20, is where the toe start and then followed by the feet and ankle and then knee. So this is the motor strip and this is the sensory strip. They are really very small. It's about the temporal loop. So it's maybe like 6 inches, 7 inches from one side to another side.
GV8 for this side, for that knee. I'm right there. So there's your toes, and your feet, and your ankles, and your knees. They're like that.
For each of the vertebrae in the cervical, thoracic, lumbar, and sacrum spinal cord, consult the notation chart in the Lazy Bum book. Each of those vertebrae will correspond to one or multiple organs. Bronchial plexus are the 3 nerves that originate from C5, C6, and C7, and they become the radial, median, and ulnar nerve. And if there's any blockage at the bronchial nerve in the shoulder in ST11 and 12, it could lead to shoulder pain and limited range of motion.
Yeah. For this area, you can feel the whole ridge, you can see. Teresa asked a very good point today. Is it because he has blubber here on the neck? It's not the neck blubber, it's also the edema. Yeah, it could be, you know, something stuck that the circulation's not coming through, so it comes in as water, or it comes in as, you know, not supposed to come back. So the whole medulla area is tracing the ear to ear. So you can see that area is tight or tender. Tender, okay? Yeah, you can feel in there. And T3 is for eye, sinus, and then nose and the ears. So because he has the rosacea on the nose, that's gonna be C3, but also the eyes is cataract. So if you just like jot down all these points, and you see that a lot of it cross counter each other. So yeah, you can feel that there's a bump there.
He has a lot of those mold in this area.
So the circulation is not perfect, so it's not cleaning things out, but in that area. But you can feel the crunch. You feel the crunch right there? Yeah. You feel that crunch? Also, if you work in the neck, there's a lot of facial arteries, a lot of cranial nerves come from the side, so you want to work on both sides of the neck also. To why is the nose being affected? Why is the eyes being affected?
So you can see like the curvature here right away. An easy way to just stand like this. So when you check out the whole back, then you see some places are more raised, more tight, and some places, you know, nice and soft. But on him, you can see how it stops right there. And then when you touch, you will find something right here also. And then you can see those 2 marks, those 2 red marks. A lot of times if you have a mark underneath, it means something's been boiling and bubbling for a long time. So right there on the T5, because once again, T7 is under the shoulder blade. And you count 7, 6, 5. So right there, you see something going on.
Yeah.
Could I feel this?
Sure.
Yes. Even if on the right side, you can feel a little bit there too. You can feel both because one. Yeah, Ed, do you feel right there? There's a stop. It's a little.
Not as much.
Not as much. You're not special, I'm not special, no one's special, but it's physically there. Anyone can find it. When you find the problem, you work on it. And even here, you can feel a little bit, see? Because one side will affect the other side, Whatever it is, we always say it's a blockage.
So it was here?
Yeah, that's the kidney area. See, usually when there's a little dip in the
Lower.
Yeah.
It's tight.
But that's lower than you were, isn't it?
Yeah, so that's 7. So anything lower body
Oh,
is
that's
7,
seven.
like the kidney, the ankle. See, if you go up and down, somebody go up and down, somebody go side to side, and you feel a knot. That's a roadblock.
Seven is not here, it's
T7 is under the shoulder blade, right here, so right across here, so like right around there. Look at this whole area, but then that's 5. You see, measure progress by how many chopsticks with. Sometimes you have like a 3 chopstick knot, and then later they come back, it's like a 1.5 chopstick knot. Sometimes it's not exactly on T5, it's like a little up, a little down, but the area is being affected. It's an area. So we don't have to tighten up on, exactly right here, but area. Okay, don't call the cops. Okay. So this covers a pretty broad area. You have the whole scope here, but you don't want to chop on the bone. That's when people scream. You don't want to protect the spine just a little like this, or you could, use a bow. So I protect it, and then I just fill the whole area, and then chop. Just like when you're chopping vegetables, you know not to chop your hand, How's it feel? Where we were touching, you have extra tightness.
It's a big area.
Yeah. See, but if we do like up here, see up here, different feeling.
Yes.
See, because I'm right up here on the 1, 2, 3, not so much, but when we do like the 5, 6, 7 area, when you're picking a watermelon, right?
Yeah.
Yeah, just like that. So if you guys want, you can always start off soft, but it is not as softy. So just go a little harder, just to have that physical pressure to open up the knots. Because over there, and like chop a little, and then afterwards you can feel again, and you can feel that it does loosen up. And you feel it go deep, right? Because that reverberation and that vibration, but also because even when we use the thumb, it's a very broad surface area, but this, it goes deep. That pressure has a very small space to go.
So what does the little machine do?
This has the brainwave entrainment file, so like the ticking on the floor, this is also going in.
Actually, it feels like the bump went down a lot.
Yeah, you could even feel it because the bounce back can bounce. If you're hitting rock, it bounces different than if you're hitting the bed. You can have a little like tightness there, feel release, or even like after a hard massage, even after when I get massage, my muscles are sore. So if you get the soreness there, it's normal. It's that tightness, it's so used to being tight, but now it's loosened up. So
Would you get dizzy afterwards?
Not so much unless you get the neck. Because when you open the neck, a lot of times I have patients just even do the massage, they get up and they get dizzy. It's because you have been blocked 90% the whole time, but now you're less blocked and you have more circulation going up. Then you're like, wow, what is this blood flow in my head? I'm not used to it. It's just when you get up and then you have all this blood swirling. So there's a new sensation. So it's a good thing even. That's like, wow, you're finally getting oxygen up there and it feels different.
Yeah.
That's that dizzy you might feel.
Yeah.
We also call it chi drunk.
Yeah, I feel warm after a while.
Yeah. So sometimes if you ever have the gua sha or the cupping, sometimes you gua sha, you see all like the red speckles come out, or the cupping, the speckles come out. Sometimes even when you look, there's some of the red come out too. It's the sha, it's like the double chi, but that, you can see that happen also.
Really
But also those are like the old blood cell that's just hanging on. Where you're like, you need to go, you need to retire and go. But when you, But also pain releases endorphins to counteract that pain signal. So endorphins is healing too. Endorphins can counteract the pain that you have and promote more healing. But like 5 minutes, 10 minutes is not, 5 minutes is not hard. Even when you saw the red marker on it. Yeah, it's just like a cupping. When you have cupping, even worse. Sometimes you have like the big black mark, but that's all the stagnant blood. That's all the leftover. That's like a 90-year-old blood you don't want there anymore. But blood comes and goes, but they're so stubborn. And so when you let it go, then you always have new blood cells reproduce and regenerate. But now there's room for the growth, for the new healthy blood cell to carry oxygen, because that's all the old junk. But yeah, check, it's so much softer.
It's so much
Yeah, you could do the scan go up now, and it's not like a huge roadblock. It's still there, but before you could see it go, stop, and then go.
No, it's nothing like Before it's
The line is much blurred now. Before there's a distinct line where like it stops. But right now it's smooth. Do you feel the difference? Yeah. See, right now you don't feel that block right there. You can feel so much smoother. Whereas like now if you go deep, of course you're gonna find it. But before it was so surface that it bubbled up.
Yes.
Yeah. So sometimes you have to really dig in to look for something that's deep. But sometimes it was really bad. That deep builds up, that it can even come up and you could see some backs like crooked like this, like flat and high. Before this area you could see there was a big curvature, but now it's already flattened out. Yeah. So sometimes even without touch, then wow. Yeah. But see right now, if you dig deep, you're like, oh yeah, there's still something stuck in there from years ago. But a lot of it is clearing up.
So afterwards, we can use the machine on it,
Yeah.
so like a probe to help it heal faster.
Okay. So you can always count. You can do T7, 10, 11, 12, 1, 2, or usually after a little skinnier, you can see a little divot, and that's usually like the L2, L3. Okay, you mind if I lift up?
Nope.
Yeah, that's good. Yeah. Let's see if this good. Tender here. Usually you have a little pain there.
Oh yeah, the right
Yeah.
side more.
So you can even see the bone is a little changed. Yeah, we're not shy here. Okay, so if you feel, you can see where you feel a bump. I'm testing you guys. Okay. So it's on L2, L3. You can feel the bone change. Yeah.
Here is so tight that the T7
T7 is already tight, you can feel. You can feel the bone.
It looks like
Yeah. Is that where you usually have a problem? If the bone's, out of alignment, then it's gonna pinch the nerve. Yeah, you could already see, but up here already, you can see the color without even touching it before. Yeah. Wow, you could already feel. Yeah,
Right there.
even if you just press, you could feel the crunching over here. Very lightly, you can see.
Wow, yeah.
You could go across the bone. See, you feel the crunching? Yeah. See, right there. See, not much up here. And I'm doing very light, but you can already feel. There's a
really
crunch.
feel.
Yeah.
So that's
T7.
T7. So all the problem going down is from T7 too. Yeah, thoracic 7. Yeah. You have a little over here too. You can feel. So like anyone can feel it. There's a bump. There's a crunchies. 7. But you could go down here also, and you feel the bump. Lumbar 2 is here. But right, like this is more normal up here. No pain up here, right?
Not the same.
Not the same. Sometimes you have pain just because it's so hard. But this is what normal feels like. It's soft. There's no crunch. There's no bump.
so. Let me see the difference.
Sometimes it's like a rope knot. Sometimes it's a few chopsticks of crunchy.
Thicker, right?
Yeah,
It's
yeah.
thicker, right?
So the nerve is getting pinched. So if you think about it, mostly I'm ticklish now. I'm too late. Okay. So most of the nerve come out straight. It's very straightforward. So the nerve for the heart is not gonna be here. The heart is up here. Nerves go basically straight out. So you have digestion is in this region, and then you have lung, heart. Pretty straightforward. But if you don't know, you go look at the chart. So prostate is not gonna be up here. You think of a prostate, even if you just guess, you think just trace it back, and you say, wow, there's a problem right there. So sometimes not just this way, but if you go this way, and you go, you feel crunch. Over here, you feel the crunch. Besides the bump.
Right.
Not just everywhere you hit hurt, but if there's a tightness, it hurts more. So you could do up and down like this, but also in this area. Lower back, I like to do an angle like this way. On the tip, I use the tip more for like a focus point. Like these are small focus points. But here is a big, so you could use this. Yeah, so there's like a big area.
There are a few points that can affect the lymphatic system going up to the neck, to our blood point. And it is the heart 1, heart 2, and also this SP21, which is at the 6th rib. These points, heart 1, heart 2, and SP21, it will affect all this lymphatic system in the underarm, and they will go to the neck.
Heart 1.
Heart 1,
Heart 2. Up.
Okay.
Spleen 21.
At the sixth rib.
Yeah, but I mean, what we do is we open up anything we can feel,
From here.
and all of this will open.
Okay.
Gallbladder 25. It's just at the end of your floating rib.
So with a 13, gallbladder 25 on the side.
And then you drop down. And then you drop down. Simple, easy. Boom, that opens up.
Is it kind of in the same? And then when you're right here?
Yeah. And then the gallbladder point is at the back of the floating rib. But, where is it tight? Just feel where is the lymph.
Yeah, the lymph.
And go all around it. Heart 1 and heart 2, they're going up to our blood points at C7 and T1. You stand here. If you stand here, effortless. It's not like this, which is hard on your wrist and you're gonna. Yes. Straight wrist. There you go.
On the other side, if you are right side, if
Just stand over here.
stand in front.
Yeah. But keep your wrist straight.
These points can affect the metabolism, blood plasma, digestion, organs like liver, pancreas, and liver 14 is right below the nipple, 2 ribs down the nipple. And the liver 13 is a tip of the second last rib. And GB25 is the tip of the last rib. It's closer to the back, even though you see it looks like it's in front, but it's actually in the back.
The side for the stimulation of the liver, number 14, number 13, and just find an out point where she said, ah!
BL52, it is around the T12 on the 2 sides of 212. If the area is tight, it is caused by too much supplements or medicine, and it can cause the lower back pain or affect the strength of the leg. This is close to T12.
This is from all these years of medication.
Yeah. Just like the vitamin supplements can clog up, but a lot of stronger things out there too. So, do you ever get back pain here?
Lower back.
Yeah. Yeah, you can feel it. Wow.
So when you get lower back pain, what point would you work on?
T7. Yeah. You lift this up, you can find it over here. So you could use the handle. Instead of using your thumb, you could use that, but also you could just, get right in there.
How about your elbow?
You could use your elbow. Yeah. Yeah. So you can feel, there's that big knot right there. So any
T7.
lower back pain,
That's
low back
T7.
pain, kidney, or the gout, anything on the lower. So that's the feet, but T7 on the left. Just work on these knots, because if you have that roadblock, how's the circulation going to go down? If it's stuck on top, it's not going to go to the bottom. Sleep apnea, like we said, the sleep is on the left-hand side, but you can feel that the T7 on the left is much tighter than the right.
Sciatic nerve, it arises from L4 through S3. So all these, together they form the sciatic, and there's one on the outside of the leg. Pudendal nerve is from S1 to S4, and this corresponds to BL31, 32, 33, 34.
This is your pudendal nerve. How's that feel? BL31. Ooh, tender. For the pudendal nerve, BL31,
Right.
32, 33, 34. And it doesn't hurt on this side, right?
I'm going to show you how to use the knife to clear the blockages on yourself. This is what you should do regularly, maybe on a daily basis, and it's very easy and convenient. You always start from the top, from the head, and work downward. Okay, so to do the head, you first do the frontal loop, which is here in the middle is the hormone. Master gland, hypothalamus, and pituitary gland, and the 2 sides, GB13, left is for focus and memory, right is for emotion. So it depends on your problem. If you have more memory problem, focus problem, or if you want to have a good study result, you tap more on the left side for emotion, depression, anxiety, tap on the right side. And this is for all the hormones. So you can start from the front and work all the way to the back. And then come back again, do it a few times, left and right. And then if there's any part that you have more problem, for example, if you have more motor cortex problem, then you know where is the pain, then you work more on that area. You can go over and over again. And then if you have a medulla problem, you work on from one side to another. And the best thing is, all you have to do is just turn your head. So it's just like this way. You turn your head, but not your knife. So you turn your head and then work back and forth. So this is for the medulla problem. The same thing for the Yiming and the trapezius. So you work on the ear-lobe to ear-lobe. And it's 2 fingers from the end of the ear-lobe, and this is where you start. But you don't care if there is any pain, just work from one side to another. And all you have to do is just go underneath the earlobe, and then you can chop from one side to another. And then on the left side, this is the insula, and this is where the focus is. So if you want to have good focus, this is where you want to work more, so that you can remember things better and focus more. And then right here, GB18, right above GB17, the medulla, this is where the age center is. So if you want to have anti-aging, work more on that area. And for the eye, if you want to work on the eye, this is what you can do. You can have a book covering your eye, and then work from one side of the eye to another. With the book in between, you don't hurt yourself as much, but you can still do this way, but with the book it's more protection. Then for the C1, 2, 3, 4, C1 to C7, you can work on both sides. And then for the phrenic nerve and vagus nerve, and also the long thoracic nerve, right below the earlobe is where the SCM is. So you just chop on this area. If there's any pain, work more on that area. The same thing on the left side, it's from the earlobe down. And then for thoracic and lumbar and sacrum, you can use your knife at the back. All you have to do is just work on the one side, chop it, then work on the other side. And you can reach quite far, almost to T12. And then in order to do the lumbar, you just turn your knife diagonally, and then you just chop. And that's the lumbar and sacrum. And this is when you don't have anyone to help you. These are all, you can do it yourself without anyone's assistance. And then for the heart 1, heart 2, for the lymph nodes, this is where the heart 1, heart 2 is. And then SP21. So all you have to do is stretch out your arm or lay it on something else and then chop it. It might take some practice in order to do it correctly, effectively. So you can feel to see where your pain is. If there's pain, just work on it. Just work on this whole area. And then for metabolism, liver 14 and 13 and GB25, is 2 ribs down the nipple. This is your liver 14. It's in between the ribs. You press on it. If it's painful, then you know that you need to work on it. And then this is the second last ribs, and this is at the tip. You press on it. If it's painful, then you know there's a problem. The same thing with GB25. It is the last rib. Press on it. If it's painful, chop on it. (14, 13) GB25. It's mainly on the right side, but check also on the left side to see if there's any problem. If there's any problem, then you chop those areas too. Chopping times, it really depends on your severity. If you have more problem, then you probably need to spend more time chopping it. Be your own doctor. The more you chop, the more you're aware of your own problem. And then if you chop it often, then you know the improvement. Like if there's a problem in your Yiming, GB20, those areas, after a few times, maybe even less than a week, you will see some improvement. And then together with the chopping will help you improve faster. Happy chopping! If you find a puddle of water on the floor and you keep wiping it up, and the root cause is the leaking ceiling. So until you fix it, you will have to keep wiping it. So the same thing with our root cause. We have to find the root cause and fix the root cause before the symptoms will go away. So remember that 4 major root causes: the head, the neck, T1, 2, 3, 4, and T7. Fix the root cause, and then a lot of the disease will go away. The nerve in the head is related to a lot of organs. For example, the medulla behind the ear is related to the heart, the lung, and all the vessels. And the sensory cortex is related to the hip, the feet, the ankle, the toe. So it's like chicken and egg. We need to work on both. So work on both the medulla, the head, and also the T5, T5 for heart, T4 for the lung, and also the vessels. And the same with the sensory cortex. We work on the motor and sensory cortex and work at the same time at T7 for any lower limbs problem. So this is chicken and egg. We don't care which one is the cause, we just fix both of them. And then use the Lazy Bum book as reference. That's a lazy way to easily fix the problem. And there's so many illnesses in that book, and they work very well. When we do the chopping, we release a lot of free radicals. So if you have those devices like the bomber, you can use those and put it in that ouch point or the location after you do the chopping, and that bomber will absorb all the free radicals coming out. And when you, after chopping, you feel relaxed and sleepy, and that's good because your body is regenerating and you need to rest. And the best thing is set up a schedule, be consistent, like you find a time either in the morning or before you go to bed and do your chopping. Chop like 5 to 10 minutes, either for the head, depending on the severity, the neck or the spine. Just be consistent. It's simple and easy. Do it yourself. You don't have to rely on other people, and you save time and money. And when we clear the blockage, the body can start regenerating. We remove the blockage and the body will do the rest.